good evening, wherever you are in the world, and welcome to this FIP webinar on pharmacists' role in advancing self-care and universal health coverage. This is actually not an entirely an FIP webinar. We're very proud and honored to have organized this webinar and this event together with the WHO and the Human Reproduction Program of the United Nations. But I will be speaking on that in a moment. So if we can have the following slide, please. Thank you very much. I'm also delighted to co-moderate today's event with my colleague, Dr. Dalis Bages, who is Senior Program Lead at FIP. My name is Gonçalo Souza Pinto. I'm the lead for practice transformation also at FIP, the International Pharmaceutical Federation. And Dalia, just for a moment, if you can just briefly introduce yourself.
Thank you so much, Gonzo. My name is Dalia Bages, and I'm delighted to be co-moderating this webinar and welcoming our esteemed guests and all the participants online. As Gonzo already alluded to, I'm Senior Program Lead at FIP and will be presenting a little bit of background work that we are embarking upon in collaboration with the World Health Organization. Thank you so much, Gonzalo. Over to you.
Thank you, Dalia. Next slide, please. So you'll have seen the program of today's event, and we'll be covering that in a moment as well. But we have a wonderful panel of organizations and speakers that will be contributing to today's event from different angles on this important discussion around the role of pharmacists in advancing self-care and universal health coverage. Next slide. So just a few announcements first, or some house rules. Well, the webinar, as you are aware, is being recorded and is also being live streamed via YouTube. So greetings also to those colleagues that will be watching later on and those that are watching the live streaming as well. And the recording will be available on our events website, so www.events.fip.org. And you can share the recording also with colleagues if you find it enlightening. You may ask questions using the Q&A box. You will see that there is a chat box and also a Q&A box or tool. Please, if you have a question for the panel or for a specific panelist, please use the Q&A tool, not the chat box, okay, so that we can capture it and address it to the panel. And you are very welcome to send any suggestions, any proposals for other webinars, or any comments that you may have to webinars@fip.org. And finally, we do invite you to become an individual member of FIP so you can avail of all the membership benefits and join this large family of FIP, of colleagues from around the world. Next, thank you very much. So as you may have seen, FIP, this webinar is happening within the framework of the activities that FIP is organizing for Self-Care Month. Self-Care Month is organized internationally from the 24th of June until Self-Care Day on the 24th of July. So for this year, FIP has adopted the theme or a variation of a theme that we're using for a broader campaign around the world, around the role of pharmacists. So it's Think Health, Think Pharmacy, and Think Self-Care. And our aim for this, with this month of activities and events and publications, is to empower self-care through pharmacists and advocate for that role of pharmacists in empowering self-care. Next slide, please. As I met the previous one, please. Thank you. As I mentioned, we are delighted and proud and honored to co-organize this event together with the World Health Organization and the Human Reproduction Program, which is a United Nations interagency program. And Dr. Manjula Narasimha is speaking today as part of our esteemed panelists from the World Health Organization. Thank you very much, and many thanks to WHO also for collaborating with us in disseminating and putting together this important event today. So the objectives that we have in mind when we organized this event is that attendees may learn about the importance of self-care practices among patients in the current healthcare terrain and how pharmacy can contribute to that and the role that pharmacy plays, but also what strategies can be employed to promote self-care practices among patients and among the community and support well-being, and that's physical well-being, mental well-being, and emotional well-being, and how to utilize the existing framework, whether those are by the World Health Organization, by FIP, by the Global Self-Care Federation, or other organizations, to advance self-care practices, but also to demonstrate proficiency in assessing individual and community needs and how we can tailor interventions to advance self-care. And finally, we'll be also discussing the role that pharmacists can play in the self-care arena as part of a multidisciplinary healthcare team, and how health self-care contributes to the sustainability of health systems, their efficiency, and also to universal health coverage. Next slide. Thank you. So today's program, and not really going into a lot of detail, we will start with a presentation by Professor Manjula Narasimhan from the WHO on the WHO competency framework on self-care interventions. That will be followed by a presentation from Ms. Judy Stenmark from the Global Self-Care Federation on the United for Self-Care initiative. And Judy will be providing us with an update and the planned goals for that initiative. We'll then continue with a presentation on the patient's role and responsibility in self-care by Hussein Jaffrey, who is the Executive Director of the World Patients Alliance. And the final presentation in the panel will be by Dr. Shan Moodley from the FIP Community Pharmacy section, who will be speaking on the role of pharmacists in empowering people to self-care towards UHC. We will then have a short video with some testimonials on the role of pharmacists in self-care from around the world. And we will have some time for questions and answers from the panel. Thank you. So the concept of self-care, and just as a brief introduction, really is about empowering the individual and empowering our communities to be able to care for their own health and maintain health and well-being throughout the life course. And of course, this will contribute to placing a lower demand on healthcare systems and indirectly contribute to more efficient and sustainable healthcare and therefore to universal health coverage. But it will also empower individuals to take this responsibility through health literacy by being able to understand how their body works and what their needs are, and taking the appropriate measures to live a healthy life. And that can be done to a lesser or a stronger extent, to a further extent, with the support from healthcare professionals, including pharmacists. Also, we need to empower individuals so that they can manage minor ailments when they do appear. So that's also part of self-care and advancing self-care, and also the important role that pharmacists play in their communities. Next slide, please. And FIP has been prioritizing the area of self-care and how pharmacists can contribute to empowering patients and communities to care for their own health through a variety of resources, publications, and short videos or CPD bites on a variety of topics that you can find on our self-care microsite, which we'll be sharing later in the presentation, and with the URL and the QR code so that you can easily access it. And now it is my pleasure to invite my colleague Dalia Barvis to provide some reflections as well before we initiate the panel presentations. Over to you, Dalia. Thank you.
Thank you so much, Gonzalo, and welcome everybody. Thanks for the brief introduction, Gonzalo, on self-care as a concept and setting the scene for us. I'd like to just begin discussing this very important topic by talking a little bit about the importance of the needs-based approach when it comes to enhancing our professional roles and the services that we provide in the area of self-care exclusively as part of this discussion. It is important for us to highlight the importance of adopting a needs-based approach to advocating and preparing the health workforce, including the pharmaceutical workforce. FIP advocates for a needs-based approach to the advancement of our pharmaceutical and pharmacy education, linking pharmaceutical education with the health needs of our populations and national priorities. And this is really important for us to keep in mind as we progress with the discussion today. As depicted on your screen, this approach requires that pharmaceutical education, in this case, to be locally or regionally determined, socially accountable, globally connected, and quality assured to meet the health needs of our communities. This is very important to keep in mind, as a needs-based approach is desirable for the transformation of pharmaceutical education and to link education and training, professional development with the health needs of our populations and priorities. Therefore, embracing this approach in the educational professional development journey of the pharmaceutical workforce along the continuum of lifelong learning is quite crucial. Crucial for aligning that profession with the evolving health needs of our communities with self-care at the center. This approach further enhances our role to identify those specific health population needs, to ensuring that whatever pharmacists and their pharmacy support teams are providing is directly related to those needs and also is impactful, which is a very important thing to hone in on. So by focusing on those needs of our populations and communities, our pharmaceutical workforce can develop targeted competencies that equip our current and future pharmacists with the skills and the knowledge required to address prevalent health issues effectively. So therefore, all of our professional development activities tailored to those needs will foster a workforce that is capable of delivering high standard, proficient, as Gonzalo initially mentioned, patient-centered, including in the area of self-care. This method or this approach not only enhances our ability to contribute to better health outcomes, but also ensures the efficient use of healthcare resources, ultimately supporting our public health goals, the achievement of universal health coverage, which is in the title of this presentation today, about the importance of self-care in achieving universal health coverage. So therefore, I wanted to mention this approach to keep this in mind as we think about how we might empower pharmacists to empower individuals and the public to embrace self-care interventions. If I may have the next slide, please. Thank you. Our esteemed guest, Dr. Manjula from the World Health Organization, will talk to us about the World Health Organization's Global Competency and Outcomes Framework for Universal Health Coverage later on, which serves as a comprehensive guide for aligning health professional education and development with the core principles of universal health coverage. If I just get you to click one more time, please, thank you. Just wanted to point out that this framework, as Manjula will do so, outlines the essential competencies for health professionals, including pharmacists, need to effectively meet the diverse health needs of populations. For pharmacy, this linkage is crucial, as pharmacists play a pivotal role in medication management, patient education, and the provision of essential health services. Importantly, the framework emphasizes the promotion of self-care, equipping pharmacists with the skills and to educate and empower our patients to take an active role in managing their health. This includes guidance on the safe use of medications, lifestyle modifications, and preventive health measures as well. By supporting self-care, pharmacists can enhance patient engagement, improve health outcomes, and reduce the burden on healthcare systems, as Gonzalo mentioned earlier. Through this alignment, the framework not only elevates the standard of pharmacy service and practices, but also reinforces the integral role of pharmacists in achieving universal health coverage and promoting self-care. On the next slide, thank you, Mafon. I'd like to mention again, just as a brief intro into Manjula's presentation next, that in July last year, the World Health Organization released a series of 3 documents outlining competencies, knowledge, and curriculum for health and care workers to support people's self-care. These will be covered in more detail, like I said to you, by our esteemed guests, but they are there to support health professions and healthcare workers' development in the area. FIP is honoured to have taken part in the Technical Advisory Group for Self-Care. I'm still on the previous slide, thinking wrong. FIP is honoured to have taken part in the Technical Advisory Group for the Self-Care Competency Framework and Self-Care Implementation Guidance in 2023. Through these consultations, FIP represented the profession and highlighted the crucial contribution pharmacists make in supporting self-care through primary healthcare roles. Additionally, FIP strengthened its partnership with WHO and usually does that by expanding initiatives to evolve pharmacy education workforce development, as I've mentioned previously. One such initiative stemming from this latest work or collaboration with WHO is our plan to adopt the WHO Knowledge Guide for health and care workers to support people's self-care for pharmacists and their support workforce. We are proud that this work will be conducted in collaboration with WHO later this year. On the next slide, I would like to bring, finally, try to highlight to our listeners that self-care is emphasized in all of our FIP knowledge and skills reference guides, including those covering 5 non-communicable diseases. This underscores FIP's commitment to enhancing pharmacist-led services to support individuals in managing their own health. I invite you to explore these publications by visiting our website, and I'm sure my colleagues will be able to support you with a link in the chat box as well. With that, I conclude my brief intro, and it gives me great pleasure to introduce our first esteemed guest speaker, Dr. Manjula Narasimhan, who is the lead for self-care for health and well-being at the World Health Organization, Department of Sexual and Reproductive Health and Research. Welcome to the call, Manjula. It's lovely to have you. The floor is yours.
Thank you. Thank you so much. And can you hear me? Yes?
Yes, we can. Thank you, Manjula.
Okay. So good afternoon, everyone, and thank you for inviting me to be part of this important discussion on the role of the pharmacists in advancing self-care and universal health coverage. So I was asked to share the key elements of the WHO Self-Care Competency Framework, which is the set of the 3 interlinked documents that we published last year, July 2023, that Dalia mentioned just now. And so in the next few slides, I'll be covering some of the background to the frameworks. And really, these frameworks informed the development and the content of these self-care competency framework. Just wanted to say a few words on our WHO's position around self-care, in that we have really seen during the COVID pandemic the importance of self-care, the importance of individuals in self-managing their health, in even the worst of circumstances. And given the number of fragile humanitarian settings that there are, the people, refugees, it's going to become more and more important for improving the autonomy, the resilience of individuals. And the role pharmacists play here is so important because we are counting our health systems in many places, but in most places now they're getting more and more stretched. And so this area and this intersection about importance of improving coverage and improving self-care options and the role of pharmacists in doing so is really a critical conversation to be had, and I'm really glad to be part of this. So next slide, please. I'll try to go through these slides quite quickly. I'm happy to go back and understand in the Q&A. So firstly, the WHO conceptual framework for self-care is really people-centered. It's about putting them at the center and acknowledging that people are accessing information, counseling, products, and services beyond traditional clinics and health facilities. And this includes, next slide, please, the increased role of pharmacies and pharmacists in this space, in addition to other means of access, such as through digital platforms, a space where pharmacies also play an important role. Next slide. So, as I mentioned earlier, the WHO Self-Care Competency Framework is a series of 3 interlinked documents that bring together competency standards. That's the first one, the knowledge guide, the second one, and the curriculum guide, which is a third one. And these documents are developed as global documents to be adapted and implemented in by professional organizations such as FIP, other partners, and UN agencies in WHO at regional and country levels. Next slide. So there's a lot of different definitions and approaches and theories around competency-based education. And within WHO, the term competency is noted here. And so I'm not going to read through the slides, but you have these for reference for later. Next slide, please. And the principles of universal health coverage form the foundation of the 2022 Global Competency Framework for WHO. This is a very high-level document that is relevant to all health practitioners, and particularly those with the pre-service training pathway of 12 to 48 months. But it is relevant across geographies, across service settings, and across occupational groups. This document is not specific for self-care, but it includes the self-care, and it's a good foundational document because the lens that it takes is a lens that was developed for primary health care. And as we know, self-care is closely linked to the primary health care approach, as it's about meeting people's needs through comprehensive, integrated health services, and that includes promotive, protective, preventive, curative, rehabilitative, and palliative care throughout the entire life course of individuals. And this prioritizes primary care and essential public health functions, and also the self-care element here and outlined in all of the documents that I'll be showing is about empowering individuals, the families, and the communities to optimize their health as advocates for the policies that promote and protect health and well-being in caring for themselves, but also in caring for their role as caregivers. Next slide, please. So the competency model, and again, Dalia showed you this slide. We've adopted that within WHO. It's a behavioral model, and it takes this holistic approach to competence. And the area that's relevant for self-care are the competencies listed here to advance universal health coverage. And as we grouped these, we identified 24 competencies in 6 domains, which are the domains are people-centeredness, decision-making, communication, collaboration, evidence-informed practice, and personal conduct. Again, I won't read through the slides, but the 24 competencies are listed here. And next slide. And so when we developed the self-care competency standards, we looked at the key elements of not only the WHO normative guideline, which you see on the slide, but also these 6 domains of the overarching UHC competency framework. And next slide, please. And so within these 6 domains, the numbers you see in the brackets after each of the competencies listed here are the number of behaviors that are associated with each of them. So in total, we've associated about 34 behaviors. And again, I won't go into each of these in detail, but just for one example, next slide, please. And so we will just before we get to the examples, the knowledge guide. So we've got the competency standards and the 6 domains. The knowledge guide, which was developed, was really about how it's important to ensure that we're all talking about the same thing. So, for instance, we might have a competency or a set of behaviors, but do we really understand what they are? And so, in this next slide, the example, just taking one example, is so that the behavior which sits under the competency around communication, collaboration, has a couple of sort of knowledge items, a couple of skill sets and skill items, and a couple of attitudes. Next slide, please. And the final document with this in this 3-step framework is the curriculum. And this is really intended to support creation of learning modules at different levels, from novice to expert, and to demonstrate what kind of learning materials may be needed at each stage, with a range of teaching activities from very simple to quite complex activities. And the activities are designed for either solo learners or group activities, and the activities that will work in low-tech environment, as well as some activities that are meant to be used with advanced technologies. And again, to go back to an example, this was designed to be a set of materials that hopefully would stimulate people. And there's a range of sort of matching evaluation methods that are included in the curriculum guide. And it's really intended to help a lot of practical workers, including pharmacists, and to support people to become capable in self-care, or more capable in self-care. And we hope that it also might help institutions if things become part of the accreditation. So these are the 3 documents that form the WHO self-care competency framework, and the links are noted on the slide. These are living documents, which means that they will be adapted and they'll be revised with feedback from health workers. And so we at WHO look forward to your feedback to make these more accessible, more useful, more user-friendly, and as we get more evidence also on the ground on how it's being used and how we can adapt it, we will be doing so in the next iteration. The next slide. And I think this is my last slide. So I'd like to thank Siobhan from the Health Workforce Department, and Chris, Katrina, and Louise, who are at the Australian National University. We're all partners in helping us with these frameworks. But of course, I also really wanted to thank FIP and all the partners who were involved in the development of these frameworks. So this really was an iterative process, and brought together the feedback of all these partners. So thank you again for having me, and thank you for the opportunity to present.
So much, Manjula, for the great presentation and for the wonderful collaboration that your team and WHO in general have had with pharmacists. And I always say at our events on self-care that when you come to the page, the webpage, the WHO webpage on self-care, the image that is there is actually a pharmacy, which already says so much about WHO's position and how you have engaged with pharmacists around the world in advancing self-care. So we appreciate and we value that collaboration very much. Thank you. So if we can have the next slide, please. And it is now my pleasure to introduce Judy Stenmark. And Judy Stenmark is Director General of the Global Self-Care Federation. Again, the GSCF has been a collaborator and a partner of FIP for many years. In fact, we have a joint statement of policy on how to advance sustainable and effective self-care, and that we will be sharing on the chat box as well for your reference. And it is our absolute pleasure to be part of a coalition that Judy will be describing and referring to, which is the United for Self-Care Coalition. And Judy will be providing an update on the work of that coalition, where we are, and the following steps and the goals that we expect to achieve in the coming months and year. So, Judy, it is our pleasure to have you. Thank you so much for accepting our invitation to be part of this event. And the floor is yours. Thank you very much.
Thanks so much, Gonzalo, and it's an absolute pleasure to be here. As Gonzalo said, FIP is a key partner of the Global Self-Care Federation, and we worked very closely with them since I've been around, actually, for 6 years. So it's a real delight to be here. Next slide, please. So I'm not talking about self-care and why it's important, because I think that's why we're all here. And Gonzalo and Manjula and also Dalia have talked about that perfectly. So what I'm talking about is what we're trying to do with our United for Self-Care coalition. And what we're driving towards really is a WHO resolution on self-care. And the first thing I want to say is that this initiative, this drive, is being led by Global Self-Care Federation through our United for Self-Care coalition, or the coalition as I'll call it. It's not a WHO program. It's us working towards a WHO resolution on self-care. So many people might say, why do we want that? What will it bring? So I think you might all know that really self-care doesn't have, still now, the legitimacy that it deserves. So yes, COVID's shone a positive spotlight on self-care and on the pharmacist as that trusted healthcare professional that can be more utilized, and individuals can work more closely with their pharmacist in tandem to advance self-care and better health outcomes. But it's not happening enough, and we don't have the legitimacy for self-care. And there are many different, I would say, variations of self-care and different definitions that people ascribe to. But so we believe that having a WHO resolution on self-care will give that legitimacy and will lead to global policy change. And thereby we can move the needle, so to speak, and particularly in LMICs, or lower and middle income countries. It will also have a benefit in higher income countries. But where do we need to see perhaps more change, more self-care embedded in policy? It's possibly in LMICs. So let's go to the next slide. So this is a little picture of our coalition members at the moment. And you can see we have some of the major health organizations on here. Of course, FIP has been a driving force in here. Also the World Patient Alliance, IAPO, SCARU, International Self-Care Federation, Global Coalition on Aging, the White Ribbon Alliance, Imperial College, International Council of Nurses, International Council of Midwives. And so we realized that to make it happen, to get a resolution, we need to go together, not alone, and we need to collaborate, and with groups like FIP, of course, because we do see the pharmacist as that pivot, if you like, that healthcare professional pivot in that self-care continuum. Of course, the individual is at the center, of course, of their own health and driving their own health in a positive direction, but the pharmacist is that pivotal, that key healthcare professional. So these are the groups involved, and we have other groups who are not part of this core coalition, if you like. Next slide, please. So I just want to give you a little bit of a history of some of the things we've done just in recent times. And next slide. In November at our meeting in Sao Paulo, we launched the Declaration on Self-Care, the Sao Paulo Declaration. And I'm not going to read it all out, but it's around promoting self-care for primary healthcare and supporting UHC and supporting education and awareness. And health literacy is a major part of this process. And we're not talking about health literacy as such today, but again, pharmacist, forging health literacy, driving health literacy, things like e-labeling, the pharmacist supporting the individual on their health literacy journey, I think is key, and it's a key part of the declaration. But also about equity and inclusivity and better self-governance, and of course then the monitoring. So this was launched at the end of last year. Next slide, please. And I've just put this slide in here just to show you we had about 6 ministers of health or their key representatives from the Latin American region. So this was really a big step forward for us because we only formed the coalition, I would say, 18 months ago. And so this was a big step forward, getting all these Latin American MOHs and countries to support such an important document. And we've really used this document to support our advocacy efforts. Next slide, please. So we've got a countdown, 12-month strategy to May 2025. Next slide, because this is when we're going in. This is when we want the World Health Assembly to approve a resolution on self-care. So you can see there, that's what we're going for. And we've got certain audiences that I'm not going to go into in terms of who are our targets, but we need more support. We need greater support from individual countries and also their missions. But member states and obviously the MOHs, we need support from those groups in particular. So next slide. This is just showing you some of our countries of interest, if you like. Now, this isn't a definitive list, but what we've come up with are people that might have supported in the past, and then may have worked through different some other people and other groups on our coalition, like PATH, etc., like APSMI, some other groups, Self-Care Trailblazer groups, some other groups involved. So I just put this up here to show you that what we need right now is as many countries as possible writing to WHO to say, we want this on the agenda of the executive board in general. And we want this on the executive board agenda in January. And next slide. And we need this letter to go in before September 1. So I noticed that at the beginning, some people saying hello. You know, we've got our target countries, but that's just some target countries. But basically, we'd take any opportunity to forge it and get it on the agenda. So I noticed that we had at least Mauritius, Kenya, Lebanon, Sudan, Zambia. They were the countries I saw. Representatives from there and South Africa joining this call. So if you have good contacts with your MOH or missions, please, we have a letter, we have a draft template ready to go. Contact Gonzalo and let's move forward with this. So what we had recently, and apologies for this slide because I've just realized it's the wrong slide. We had our first Global Self-Care Summit in Geneva at the World Health Assembly. And this was a real coup for us because, in fact, we had 3 new member states co-hosting this summit. We had Egypt, Malawi, and Costa Rica. And I think that this was a real coup and a real step forward. Ignore the writing on this slide, because I think a year ago, if we tried to do this, we wouldn't have had those countries, even those countries supporting our drive. So I think Manjula was on the panel, plus some other groups, of course, key groups. FIP were there. And so I think this was a big step forward. And of course, we talked about UHC, we talked about primary health care, we talked about NCDs. But having those countries support our initiative was really key. So next slide. So I think really, I just wanted to finish off with, and you don't worry about all the dates on here. And this, think of 2025, the executive board in January. That's where we'd like it discussed on the agenda so that it can go to the 2025 May World Health Assembly. So that's really all I wanted to say. As I said, it wasn't about self-care. It was about what we're doing, why we're driving towards a WHO resolution. We can only make it happen if we work together, if we go together and we collaborate. So as I said, if you have good contacts, if you think it's possible to get someone in your country through the MOH, I'm sending a simple email. It doesn't have to be fancy. We've got all the wording. Please let Gonzalo know. And I'm happy to take questions later, and if there's any in the chat. So I hope that's given you a kind of a overview of what's happening on that score. Thank you.
Thank you so much for that, Judy. What a delight to listen to this inspiring overview. Thank you, really. That was a compelling presentation on the importance of legitimizing self-care and embedding it in healthcare policy. GSCF steward to drive a WHO self-care resolution advocacy strategy is truly inspiring. I'm sure, Judy, that everybody now has a deeper understanding of the work that you are leading in collaboration and partnership with all of your valued partners that you listed on the screen earlier. And if anybody has any questions with regards to this, please do add it in our Q&A box. And as Judy mentioned already, do write to us to find out more on how you can contribute and drive this work further. Brilliant. Thank you so much, Judy. So now it gives me great pleasure again to introduce our next speaker, Mr. Hussein Jaffrey, who is the Executive Director of the World Patients Alliance, is with us today. And the floor is yours, Hussein, to provide our attendees and our listeners an overview on the patient's role in self-care and how they are at the center of all of this. Thank you so much. Over to you.
Yeah, thank you very much, Delia, and my thanks to FIP for organizing this wonderful webinar. I think this topic is very close to my heart personally as well, and I think it's very important to discuss the role of patient because it all boils down to the patient. You know, if there is, the patient takes up the responsibility and the patient participates into all of this, I think it all boils down to the patient. So I think it's very important to discuss what is the patient's role in self-care. Next slide, please. So let me just introduce World Patient Alliance to you. We are the world's largest umbrella patient organization that works across all disease areas, and we provide that platform and voice to patients to raise their voice globally. Next, please. So you can see this is, we are through our members present in 129 countries of the world. We have a total of 540 members so far, and you can see we have quite significant membership in all parts of the world. So the green color shows where we have our members in the world. Next, please. So today we'll explore how patients can actively participate in their own health management and why this is crucial. Moreover, what are the practical ways to enhance self-care practices? Self-care is a fundamental aspect of health management, essential for preventing illness and improving quality of life. So today we aim to understand the patient's role in self-care, exploring their responsibilities, and discuss effective strategies to enhance self-care practices. Next, please. So let's first remind ourselves of the Alma-Ata Declaration, which basically states that the people have the right and duty to participate individually and collectively in the planning and implementation of their healthcare. So this basically emphasizes the need of patient active engagement in their own healthcare, which basically, you know, self-care is all about. Next, please. So self-care involves any activity that individuals engage in to maintain and improve their health, prevent illness, and manage existing health conditions. It encompasses a wide range of activities such as regular physical exercises, balanced nutrition, adhering to medical schedules, and attending regular health outcomes. So it encompasses everything is from prevention to the disease management itself. Next, please. So effective self-care leads to numerous benefits, including an improved quality of life, reduced health care costs, and increased longevity. So, for example, individuals who engage in regular self-care activities often experience better health outcomes and can manage chronic conditions more effectively. Empowering patients with self-care skills helps alleviate the healthcare workforce workload and enhance overall healthcare efficiency. It assures significant reduction in hospital visits among patients who actively participate in their self-care. Next, please. So patients are central to their own health management. They must actively participate in healthcare decisions and make informed choices about their treatment and lifestyle. Self-monitoring is crucial. This involves tracking symptoms and keeping a record of health metrics like blood pressure or blood glucose levels. Lifestyle changes such as adopting healthier eating habits and incorporating regular physical activity are vital components of self-care. Next, please. Patients have several key responsibilities in self-care, including adhering to treatment plans and attending regular medical appointments. Health literacy is crucial. Patients must understand their medical instructions and know when it is necessary to seek professional help. Effective communication with healthcare providers ensures that patients receive the appropriate care and support, fostering a collaborative approach to health management. And patients should also work closely with their healthcare providers for shared decision-making that ultimately results in improved health outcomes. Next, please. So while self-care is crucial, many patients encounter significant barriers, and we'll explore some of them in this slide. A lack of knowledge about effective self-care practices can lead individuals unsure of how to manage their health. Limited access to healthcare resources, whether due to geographical location, financial constraints, or availability of services, further complicates the availability to engage in self-care. Socioeconomic constraints can also make it difficult to afford necessary medication or maintain healthy diet. And then additionally, psychological factors like anxiety and depression can severely hinder someone's, practice of self-care. Next, please. So education and awareness are foundational to effective self-care. Patient education programs can significantly improve knowledge and skills. Education materials like brochures, websites, and online education and training provides essential information to help patients make informed decisions about their health. Support systems, including family, community, patient organization, and healthcare providers, play an important role in encouraging and maintaining self-care practices. And then technology such as mobile apps and telehealth can provide accessible tools for managing health. Furthermore, personalized care plans tailored to individual needs are also highly beneficial. Next, please. Healthcare providers act as educators, offering patients the necessary knowledge and tools to manage their health effectively. They also provide critical support, motivating and encouraging patients throughout their self-care journey. A strong patient-provider partnership is essential for setting realistic health goals and ensuring that patients receive comprehensive and personalized care. Next, please. The future of self-care is promising, with advancements in personalized medicine and digital health technologies offer new opportunities for patients. However, we must be mindful of the fact that we must also address challenges such as ensuring equitable access to these technologies and integrating them effectively into the healthcare systems. Next, please. So this slide highlights the various strategies that patient organization can or could do to promote self-care. The first of all, patient organizations can implement health literacy campaigns, seminars, and webinars to equip individuals with essential knowledge. Organizations also work towards creating and sharing printed materials, online resources, and mobile apps to ensure accessible self-care information. Patient organization can establish peer support groups, online forums, and mentorship programs to facilitate the sharing of experiences and mutual support among patients. They can also advocate for resources, influence policy, and ensure representation to address patient needs and secure adequate support. Launching public awareness efforts, social media campaigns, and organizing community events can help patient organizations basically highlight the importance of self-care and reach a broader audience. And then developing self-care assessment tools, education modules, and interactive programs can empower individuals to manage their health effectively. And with patient organization providing the necessary resources and guidance. Next, please. So patient organization can encourage regular screening and checkups along with preventive health education to help detect and manage health issues early. Initiating grant programs, forming research partnerships, and offering scholarships are ways patient organization can advocate self-care practices and treatments. And by incorporating telehealth services, wearable devices, and e-learning platforms, patient organization can enhance patient access to care and self-management tools. Launching patient leadership programs, empowerment workshops, and decision-making tools can help patient organization enable patients to make an active role in their healthcare. And then tailoring programs, providing language support, and fostering inclusive initiatives and strategies patient organization can use to ensure that all patients receive appropriate and effective healthcare. Next, please. So in conclusion, effective self-care is crucial for managing chronic illnesses and enhancing patient outcomes. Patients who actually actively engage in self-care, including adjusting their behaviors as the disease progresses, experience improved quality of life and reduce hospital readmissions. Education and support are vital for improving self-care practices, with family caregivers playing a significant role in providing essential support. Optimal self-care requires a thorough understanding of the illness, the ability to interpret symptoms, and taking appropriate actions. Innovative patient education strategies are needed to develop these skills and ensure the use of trustworthy resources. Collaboration with partnerships, with providers is a key to fostering effective self-care. And then last but not least, patient organizations have an important role in promoting self-care on the local, national, and global levels. Next, please. This is just an announcement. This is our second World Patient Conference, which is going to be held in Cape Town, South Africa, 19th to 20th of October. And we have a full session on self-care where Dr. Manjula from WHO and the Self-Care Federation, all of us are participating. So I would invite all of you to please join us for this conference. And thank you very much.
Hussein, thank you so much for your insightful presentation. It's wonderful to be able to hear from an international or global organization such as the World Patients Alliance to really refocus our attention on the patient, and also, I guess, in a way, the multiple layers that we might have to identify as healthcare professionals when wanting to empower patients to better support themselves, better manage themselves in health. I have a question. I might just save that for the Q&A where we can unpack some of that. That was really wonderful. Thank you for your time and for being with us. We'll see you at the Q&A panel discussion. And now it gives me more pleasure to introduce our final presenter, our dear colleague, Dr. Sham Moodley, who is a member of the Pharmaceutical Society of South Africa and also the Independent Community Pharmacy Association. But Sham is also FIP Community Pharmacy Section's Executive Committee member. Welcome, Sham, and the floor is yours for us to be enlightened by your presentation. Thanks a million.
Thank you, Dalia, for that introduction. And it really gives me great pleasure to be on this very esteemed panel this afternoon. Thank you to FIP for organizing this amazing session. And I think it has been exceptionally enlightening from the presentations that's already been made. So if I move on to my first slide, there are multiple factors that indicate a dire need for better patient support. And this often begins with self-care, as you've already heard from the multiple speakers that have spoken about it. And they really include the spiraling healthcare costs, the poor health outcomes that we're experiencing worldwide, and the continued health disparities across multiple countries. The average worldwide out-of-pocket spend is as high as 17% of current healthcare expenditures. And as you know, this puts many households into extreme poverty. Whatever we are spending, only half of the world's population gets access to it. The rest have no essential healthcare services. If we move on to the next slide, you will note that some countries are not able to meet their healthcare budgets, and many countries spend adequately in terms of their GDP, but are unable to achieve the necessary healthcare outcomes. South Africa in particular is one of these really good examples where we spend about 8.5% of our GDP on health, but we've never been able to adequately achieve this consistent production of good services to communities and health outcomes. And this really requires this major shift that you've heard already and what the world is talking about. If we move on to where the opportunities may lie, you would note that this disease burden by cause measured in disability-adjusted life years provides an opportunity for pharmacy to interact, especially in the areas of NCDs and communicable diseases reflected in this graph. You can see the huge opportunity where pharmacists are able to interact on both those areas and make a substantial impact. And we'll talk a little bit about that as we go along. In my next slide, we look at this shifting the treatment options to self-care and primary healthcare, and we see that it will provide us with really positive inverse impact on the overall cost of healthcare. So, and there's sufficient evidence to suggest that pharmacist intervention models in many chronic conditions such as diabetes, hypertension, asthma, and other minor ailments, allowing the pharmacist to manage these programs more effectively will significantly contribute to this healthcare saving and this cost reduction and this transfer of costs from high hospital costs into primary care and into self-care. And self-care, there's enough data to suggest that as we improve self-care, budgets are reduced and we can then spend that more effectively on better healthcare. In our next slide, we want to look at what about primary healthcare in the context of self-care. So pharmacy exists across all sectors and most importantly at the point of care, and are able to deliver from supply chain to overseeing drug usage, drug interactions, adverse drug reactions, adherence monitoring, and managing minor ailments across multiple sectors. And you would note that we cover from medicine expertise to the people-centered care to access to medicines in terms of this portfolio that pharmacists interact with on a daily basis. In our next slide, closing the gap between the consumer's desire to practice self-care and their functional ability to do so, a quotation that I've taken out of our CEO, Catherine Duggan's presentation, it really requires several interventions, which includes empowering individuals and communities, strengthening national institutions, improving primary healthcare, strengthening outcomes, reducing costs, and relieving pressure on an already overburdened healthcare system across the world. Self-care has the potential to help solve some of the world's most pressing macro and micro public health challenges, including the pursuit of universal health coverage and prevention and management of chronic conditions and the provision of high-quality care for fast-growing common ailments. In our next slide, this does require several enablers, including stakeholder support, consumer empowerment and literacy, innovative policies within pharmacy and any other healthcare professional that's dealing with self-care, and strengthening the regulatory framework. Pharmacists must be allowed to do more than they are doing at the moment. We must utilize their services to the maximum of their potential. In the next slide, we see that pharmacists can play multiple roles, from raising community awareness as healthcare promoters, working with local healthcare teams, providing evidence-based advice through communication, as community coaches and individual coaches in terms of patient care, as prescribers, and in terms of the supply of quality product and services. And that's what the shift requires, the self-care shift requires, a continuous improvement in all of the work that we have designed and are doing currently. We need to improve on that and make sure that we connect and make the patient the center of this focus, because self-care is part of what they will grow with. In this next slide, within the pharmacy, and as the first point of contact, you've seen this circle before in an earlier presentation. As a first point of contact, the important task of medicine provision, individual patient medicine management, education, pharmacist-initiated therapy, and assisting in progressing this very fast-moving digital space, this digital environment, in terms of telemedicine, for example, these multiple apps that patients are using. The important thing is assisting them to interpret the data and the results of it, providing that educational gap that is required, and pharmacists can be this touch point in self-care. In our next slide, so in this FIP summary, which encapsulates the role that pharmacists play in providing services beyond dispensing, including disease screening, clinical decisions in treatment initiation and progress, providing medicines and services beyond the walls of pharmacy, and the whole concept of first aid and self-care. And these are important tools that you can utilize within your own pharmacy to improve patients' value in terms of self-care. Next slide. So at a practical level, in this continuum of patient care, what is required is support with evidence-based, unbiased, and sound advice about self-care, the available treatment options that patients may have, and an accurately identifying treatable conditions. We need to adapt the communication that takes place between healthcare professionals and those that are accessing services. And we make sure that the literacy level that we are dealing with is at the level of where patients understand, are able to interpret the information that you are providing. The next is to encourage the individuals to provide enough information. So gathering that information and providing them the best possible access to treating their condition would be a major tool that pharmacists already have and can utilize in self-care. Verifying product safety for use in self-care conditions. And a good example would be somebody that's accessing medicines while they're pregnant. And if you leave it to self-care alone without the level of information required, there might be consequences to that interaction. We need to create an opportunity for dialogue so that the patients feel comfortable in terms of discussing their needs their side effects, and anything else that they're concerned about in terms of management of their care. The last is to act as this gateway to able to triage patients so that you can either treat yourself or refer for appropriate treatment. The next slide, in summary, then pharmacists play these multiple roles in terms of prevention, detection, minor ailments, chronic disease management, and combined with that, there are two important tools, I think, that you can go back with to look at. First is the issue of health literacy within your community. Are you servicing a community that understands what you're translating to them? And the next is to look at this digital space that's opening up and how to better manage patients in terms of self-care. My last slide. From an FIP point of view, the strategic approach taken by FIP can possibly be broken down into 3 areas. And I think a lot of work in terms of the community pharmacy sector, for example, is being done trying to remodel and redefine what roles pharmacists can play at the forefront here. The first is the focus being on achieving equity in health literacy across all settings. The second is the design around pharmacy self-care benefit offerings and packages, which includes training, expanded pharmacist consultation services, emphasis on pharmacy-initiated therapy, interprofessional collaboration, support through primary healthcare networks, and designing and using technology. Finally, the critical final role includes advocacy through interaction, influencing both primary and secondary education in our schools, for example, in terms of self-care in their own curriculum, reorientating the undergraduate pharmacy training, and ensuring a really important issue is that pharmacists have access to the full patient's record and are able to input information around self-care into that, because then you have an approach of a holistic care. Thank you very much. That's my final slide. Thank you very much. Over to you, Dele.
Thank you so much, Shan, for this presentation. I think you've just provided a magnificent overview of how pharmacists can empower patients and communities to self-care, but also what are the enablers, the challenges that we may need to address and to make that role more and more a reality. So I think that this concludes the presentations from our panel today. And before we move on to the Q&A session, and I do encourage all our participants to address any questions to our panel through the Q&A tool, what I would like to do first is to thank our colleague Mfonobong Ekpo, who has been the facilitator of this event. And although she's playing a sort of discrete role during the event, she was leading the organization of the webinar itself, and the video that we will now watch that collates testimonials on the role of pharmacists in self-care from around the world. So, Mfon, thank you so much, and please move on now with playing the video. Thank you.
Pharmacists empower people to self-care by improving health literacy and supporting informed decisions and choices for people's healthcare. This includes greater access for self-care interventions such as a diagnostic for pregnancy self-testing, a device for self-monitoring blood pressure, or over-the-counter access to emergency contraception, but also self-care actions for adopting healthier lifestyles. Living a healthier life through greater self-care contributes to universal health coverage, and pharmacists play a big part in that.
We provide various services to our patients to help them with self-care. We advise them to get their health checks done regularly and keep a record of them. We provide blood pressure and blood glucose monitoring services. and we guide patients through medication adherence, lifestyle modifications, and also encourage home testing of blood glucose and blood pressure. And we also make everyone aware of our other services like tobacco cessation, guidance on weight management, diet, and other preventive health measures. We also create awareness and encourage self-care through our health information boards, video presentations, making available several information leaflets, and organizing various health days and camps. Our pharmacists are always available to guide patients and answer their queries. So we thus try our best to promote healthier lifestyle, preventive care, and encourage our patients to take care of their own health.
We provide expert advice to guide our patients on how to choose the most appropriate self-care products like over-the-counter medications, vitamins, or supplements to help them achieve the desired health outcomes. We also educate patients on the proper use of medical devices like blood glucose monitors and inhalers, for example. We offer nutritional and lifestyle counseling to support patients in making healthier choices like smoking cessation, improving diet, or exercising. We also conduct medication reviews and chronic disease management programs to ensure patients understand how to take their medications properly.
Self-care interventions are vital for health maintenance. Equitable access to safe, effective, and high-quality self-care products like medication and health technology is essential for achieving universal health. Most visitors to my pharmacy are over 65 years old, retired, who may or may not live with a family member to assist them with their illness. Therefore, at the pharmacy, we promote the use of pill organizers to ensure the daily intake of medications. For users who take multiple medications, we emphasize the use of organizers with different colors for morning, midday, afternoon, and evening doses, catering to their varying schedule through the day. Whenever it's possible, we recommend to set an alarm on their watch or cell phones as a reminder for medication intake. The focus is also on supporting them to self-care. This includes advice on having a healthy diet, focusing on seasonal fruits and vegetables, as well as engaging in light exercise like outdoor walk or easy cycling.
As a chief pharmacist, I see pharmacists as patient superheroes. That's why we are training them as self-care champions. Using knowledge and then tech like WhatsApp, SMS, and our upcoming mobile app, they guide patients through everything from chronic conditions to everyday concerns. However, patients get clear explanations, medication understanding, and become true partners in their health journey. Together, let's bridge the healthcare gap and empower individuals for a healthier future, one patient at a time.
Today, I'm going to try to show you a case about sexual and reproductive health and how we as community pharmacists can empower our patients and individuals and community to help them. For instance, when a woman will come to our community pharmacy asking about the help to contraceptions, it is our duty not to imply to her what to take, but to give her and to educate her about all contraceptive methods. And then when she will be at home, she will have to choose, the freedom to choose, because she is empowered and knows very well all the contraceptions method, to choose the right method for her case and for her convenience.
Hello everyone. Community pharmacists in Malaysia play a crucial role in supporting self-care, empowering patients to take control of their health. We provide essential health education and advice on disease prevention, management, and healthy lifestyle choices. As a practical measure, many community pharmacists offer health screening, such as blood pressure and blood glucose testing using point-of-care devices, helping patients to detect the onset of non-communicable diseases, NCDs, and monitor their management. With NCDs estimated to account for around 74% of all deaths in Malaysia, this is indeed important work. Recently, in our practice, we have started to adapt to digital health trends to offer the same advice and services securely online. By providing these services, we promote health and contribute to lowering costs in a health system that is increasingly limited in resources. I look forward to an expanded role for our community pharmacists in Malaysia and beyond, even as the emphasis of our health system shifts from curative one to preventative care.
Hello everyone, my name is Lars-Åke Söderlund. I am one of the Vice Presidents of FIP. With regard to the Global Self-Care Month, I would like to emphasize that as the global healthcare system continues to evolve, with individuals feeling a greater desire to manage their everyday health, self-care is expected to have an increasing role. As such, we need a new approach to healthcare that empowers people to look after their health, freeing resources for patients with acute healthcare needs, and pharmacists are at the forefront of these changes. As accessible, trusted, and knowledgeable healthcare workers, pharmacists represents the first point of contact within the healthcare system for many patients, and as such play an important educational role. There is much evidence demonstrating that pharmacist input into self-care is highly effective. Our capabilities relating to self-care include disease prevention, immunization, detection of diseases via point-of-care testing, and management of lifelong diseases or non-communicable diseases. Promotion of self-care is a means to empower individuals, families, and communities for informed health decision-making. It has the potential to improve the efficiency of health systems and to contribute towards health equity. So self-care is healthcare. Think health, think self-care, and think pharmacy. Thank you.
Very much to all the colleagues that contributed with their testimonials and their views to this video. Thank you so much. And a big thank you to Manjula, who is on our panel today, that also was one of the contributors. And following on, and before the Q&A, we would just like to share with you that we are launching today 2 new summaries of publications that were published in 2023 that are very closely related to the topic that we're discussing today, which and one of them is about both of them are about new roles and making of pharmacists and leveraging pharmacies as healthcare destinations, as the gateways to care, and in advancing self-care as well. One of them is on point-of-care testing at pharmacies and how that can support decision-making, clinical decision-making at the pharmacy, and also release some pressure on other parts of the healthcare system, and support patients as well in understanding their health and being able to making decisions. And the other one is on the management of common ailments in the community pharmacy. So many countries are introducing common ailment schemes that leverage pharmacists' expertise and their accessibility as destinations for people to go to for the management of common ailments. So this is paired with regulatory changes that allow pharmacists to prescribe certain medicines for the management of those ailments. And indeed, this embeds and integrates community pharmacies in the network of provision of primary healthcare services, therefore effectively integrating pharmacists in primary healthcare and self-care promotion. So you're welcome to visit the website, the self-care microsite, or the FIP website, or scan the QR codes on this slide to access these 2 summaries with key data and messages and highlights from those 2 more comprehensive reports that were launched late in 2023. And moving on, you will find these and other resources by FIP on self-care and to support practice development in specific clinical areas, as well as general self-care concepts on our website, selfcare.fip.org. Moving on, please, and we will now we still have a few minutes for the Q&A. So I will ask Buffon to take the slides down. Thank you. And I will ask all the panelists if you can kindly open your cameras so that we have the entire panel on view. And I will ask Dalia to support with the first question to our panel. Thank you, Dalia.
Thank you so much, Gonzalo. We do have a number of questions from our colleagues, and we tried to kind of merge some of them thematically so we can support answering most of them. I will start with one important one about competency development. I might direct this straight to Manjula and any of the guests that may want to make some comments. And it's from our colleague Aslam Shah, who thanks everybody for their excellent presentations and asks to elaborate on the importance of competency-based tools training required for improving the role of pharmacists for the better outcomes in advancing self-care. And I wondered, Manjula, whether you had any comments on this, and maybe even any of our esteemed colleagues.
Yeah, I mean, I think our colleagues, Sham and others, probably can give far more detailed information on this. I think, you know, without the proper training and support, both in service and pre-service training, developing these competencies are actually critical to make sure that we provide the quality of care that we need. That includes, you know, the training and education for pharmacists to be knowledgeable about self-care options, to show the client what, you know, how to use a self-care option. And we've been working with several countries in the Africa region on the self-injectable contraception, the MPA subcutaneous. And, you know, it's important for the health and care worker and pharmacists in particular to be able to provide the information, but perhaps also show how some of these options can be rolled out. And also in terms of the diagnostics and other over-the-counter medication. So training in those self-care options that are available, that are safe, is really a critical aspect of ensuring that we can improve the coverage of self-care to the clients.
That's perfect, Manjula. I mean, it highlights really the importance of training on the job as well. And it's an evolving kind of realm, really, as more products and more services are required of pharmacists and the pharmacy teams to upskill in. And I think that the plan for us to also be adopting the WHO knowledge guide to tailor to pharmacists' training needs will be a really good, I believe, project that a lot will benefit from. Sham, do you have any further comments on that?
Yeah, this is quite a shift from the practice of healthcare, whether it is in pharmacy or whether it's in a GP room, because we've been quite fixed on this curative model internationally. And this shift into self-care demands a shift into primary care, a shift to where we started from with healthcare. And I think that shift requires a whole new knowledge base that we need to take into pharmacy, for example. And I think there's sufficient data and evidence now coming out of FIP, the Self-Care Association, the WHO, for example, that creates the framework. And I think it really needs to go back into our university syllabus, as I suggested before, and start from there. But pharmacists that are practicing at the moment, there is sufficient knowledge, scientific knowledge that's available to us to utilize to ensure that this practice becomes a scientific model going forward.
Excellent. Thank you so much, both Sham and Manjula, for your comments on this question. We also have several questions that focus in one way or another on technology and the role that technology plays in self-care, in empowering self-care. But also there are concerns around the quality of, for example, apps. There are many apps that people can freely download and use, but maybe not all of them will have the appropriate quality to support effective self-care. And do healthcare providers and professionals play a role in validating or in using or integrating those apps in self-care practices and in improving literacy also on the use of and in the interpretation, the use of apps and the interpretation of online information. So I'll address the question maybe to Hussein first, and maybe Sham can then comment from the perspective of how pharmacists can integrate technology in the provision or facilitation of self-care. Hussein, go first to you. Thank you.
Yeah, I think technology is inevitable, and I think there are more and more tools becoming available, apps becoming available, which are actually really helping patients a lot. But I take the point that there is a danger of using any apps or that are not good enough, or patients not really understanding the app properly. But I think that actually really brings back us to the point where we need to have a strong partnership between patients and the healthcare providers, and especially the pharmacist. And I think the question that was just asked earlier on, and I believe that, if not in all parts of the world, but I think in many parts of the world, especially in the developing, middle and income developing countries, the healthcare providers, including the pharmacists, they lack that skill of communication. They are taught the scientific knowledge, but they are not taught how to talk to a patient, how to be able to convey their message. And I think with these technologies coming in, I think this partnership becomes more important, because a pharmacist talks to a patient and tells them about what they are need to be doing for self-care. And I think if they can also propose some tools, online tools, which can really help in their self-care things, I think that will be very helpful.
Excellent, thank you, Hussein. Sham, from a pharmacy perspective, how do we integrate technology and apps, but also how do we moderate somehow and the use of the information that is online and provide assurance to our patients?
Sure. I think the starting point is to firstly accept that in countries like South Africa, there are more smartphones than there is population. So we've got more, the numbers are higher than the population we have. It means that technology is being used even in a developing country like South Africa. So internationally, we need to accept that this is a functional tool that people and patients are going to be using. That's the first point. The second point is to try and develop the strategy around it. And I think FIP, for example, in the pharmacy section, is running a full-day workshop in Cape Town. And this is a clear indication how seriously we've taken the issue of technology and connecting this to our patients. So the role of the pharmacist is certainly going to be changing as this technology develops. And one of the roles that pharmacists are going to be playing outside of knowing about the drugs is knowing about this piece of technology, because in terms of interpreting the data, I do think that more and more patients are going to be reliant on the healthcare professional to assist them interpreting the data. So interpretation of the data that comes out of these cell phones is important. And then, of course, reviewing and advising patients on which are the appropriate tools to be using. And I think patients would listen to a healthcare professionals in terms of what they should be using and what they shouldn't be using. So I think technology is going to become a really important part of pharmaceutical care going forward.
Thank you so much. I'm afraid we will not have time to address other questions, but the time for our webinar is coming to an end. But I would like to invite our guests today if they would like to share any final messages, a 20-second message from each of you. And I will start with Judy. Thank you very much.
Okay, thanks, Gonzalo. I guess my message is, I think we're all supportive of self-care, so I don't need to say anything about that. It's about get on board with our resolution drive so we can really move the needle. And I saw a message in the chat, a question saying, I'm from Ghana, you know, how can I get involved? So maybe that person could contact someone at FIP and they can give you my email. Please get in contact. But I would say, let's get on board the self-care train and let it happen.
Thank you so much. And Hussein, a message from you.
Yeah, I think with the chronic conditions, you know, getting, you know, a big issue at the moment and limited workforce, I think it's important that patients take up the responsibility of self-care. And I think they need to be educated, they need to be empowered to play a meaningful role in all of this. And I think this is where all of the main stakeholders, you know, that includes the Self-Care Federation, the World Health Organization, the FIP, the World Patient Alliance, and others. I think we also all need to actually sit and give importance to, not only give importance to this issue, but I think also work together on looking at, you know, how can we facilitate patients and healthcare providers towards, you know, improved self-care movement that's going on at the moment.
Well, thank you so much. And Sham, any final thoughts from your side?
Yeah, I think there's a huge opportunity for the different countries that are represented here today to access what has already been provided. The knowledge today has been tremendous. The materials that you've been exposed to from the WHO, from FIP, for example, there's a lot of quality work going into that movement in self-care. So I think there needs to be pressure from each of your organizations to access that information and make it available to the pharmacists on the ground, and to set up strategies within your own country, depending on what the laws are with your own country, to motivate and make sure that your government becomes part of this movement towards self-care.
Thank you so much, Sham. And finally, Manjula, as our co-organizer today and our close partner and collaborator, any final words or reflections from your side? Thank you so much.
Firstly, thank you so much. This has been so interesting and really inspiring to hear all the speakers. So thank you for organizing this. Just a couple of thoughts. I think, you know, in terms of the role of pharmacies and pharmacists, it's that it allows self-care options to people before they become even patients. They may be coming to pharmacies for counseling, and they can, yes, the pharmacies can, you know, advise for, you know, medication usage or side effects and all of that, but they can also provide these sort of health promotion messages. This is sort of a point of access, and to allow people just to live their best lives and avail of the best opportunities that they can. And, you know, we talked about technology, and certainly, you know, when we have urban areas, pharmacies are more accessible. They normally, you know, sometimes they operate 24/7. And by contrast, in the rural areas, it may be fewer and more limited access, and certainly also for, you know, fragile humanitarian settings. And these sort of mobile pharmacies and telepharmacy and those initiatives with digital platforms are really going to help bridge that gap. And when it's done properly, when it's done within a safe and supportive environment for the end user, this really has the enormous opportunity to improve coverage and improve quality of care.
Thank you so much, Manjula. And I think, well, our apologies that we went over time a little bit, but I'm sure that everyone will agree that this has been a very interesting session, that we have learned a great deal from our speakers today. So I would just like to also thank all of our speakers and our panelists today, and my co-moderator, Dalia, for all the support as always, and Mafon, our dear colleague that has been facilitating and made this webinar possible. So thank you all very much. Dalia, Ali, any final words from your side?
I just want to thank you, Gonzalo, for being my co-moderator for this wonderful event, and just to thank all of our esteemed guests and attendees for really insightful presentations. look forward to progressing this work with all of our partners, WHO, the Global Self-Care Federation, and World Patients Alliance, and also our FIP officers and volunteers that are always by our side. Thanks a million for that, Gonzalo. I know we have a couple of slides just to wrap up and announce for Congress, or is that too late?
Thank you. Yes, I mean, we were just going to share some information about our Congress, upcoming Congress in Cape Town. But I think that considering that we're already 5 minutes past the hour, we will invite you to learn more about the Congress on our website, and also the Think Health, Think Pharmacy campaign that we are promoting, which can also be found on the FIP website. So thank you all very much. Have a great rest of your day or evening, and we look forward to meeting you either at our other digital events or in person in Cape Town at our upcoming Congress. Thank you all very much.
Bye-bye. Take care.